Hey guys, Doc Hepps here. So your urologist placed a stent but didn't attack the stone. Why? What's the reason? We're going to answer that question for you and give you some insight as to why we use stents in urology. Stay tuned. Hey guys, it's Doc Hepps here. So the question is my urologist just lazy? He went ahead and placed a stent but didn't get rid of the stone. What's going on? So we're going to go over some things to give you some insight as to why a urologist uses a stent, what the reasons being for where we just place a stent without going after the stone. Let's take a peek at this diagram. So in this diagram, this is a cutout of the kidney, and this is a blow up of the top part of the ureter. Over here, you can see this picture where the kidney is up in the flank region and your bladder is down in the pubic area. There's a tiny little tube that connects the kidney down to the bladder, and that's called the ureter. Beyond the ureter, there's an area called the renal pelvis or pelvis of the kidney, and then there are little tunnels called the calyces. So the meat of the kidney, the parenchyma, filters the blood, and then the urine, the toxins, are pushed out into the calyces. For certain reasons and in certain folks, the urine will have an excessive amount of certain electrolytes, and those electrolytes form crystals. So in this blow-up, you can see that stones may form in the calyces. Sometimes they're often stuck to the tissue, and that's where they start out. And when those stones get big enough, or there's some sort of trauma or movement, or we don't understand exactly, those stones can break off. Now, sometimes those stones sit there for months to years and never cause problems. But when they break off, they fall into the renal pelvis and sometimes into the ureter. And you can see this gives a general idea of how small and delicate that ureter is. When that ureter is obstructed from a stone, all the urine backs up. The kidney continues to produce urine, and that urine backs up into the renal pelvis. And there are pressure sensors on that renal pelvis and kidney. And when those pressure sensors go off, they cause significant pain. They cause pain. They cause nausea. They can make you throw up. And if the urine sits back there for long enough, it can lead to an infection. And lastly, if that stone is stuck there and causing back pressure for up to 4 weeks or more, there's potential kidney damage that can be potentially irreversible. So those are some of the potential problems that these stones, once they fall, can cause. So as a urologist, when do we go ahead and recommend treatment? Well, it kind of depends on how you feel. The stone had fallen and it's been 24 hours and you're miserable. You can't tolerate fluids. Either you're continuously nauseated, your pain's just unbearable. That may be something to say, hey, we got to get you in and take care of you. Other reasons are if that stone has been there for more than 3, 4, 5 weeks, we worry about long-term damage to that kidney. Lastly, but very importantly, if there's any signs of infection, the worry is if urine backs up behind that stone, there's significant back pressure potentially. And that infected urine can push back into what's called the lymphatic system, which can get into the bloodstream. So if there's bacteria in there, that all can get pushed back and cause what we call sepsis or a bloodstream infection. If it comes to a point where we recommend treatment, then oftentimes for stones in the ureter, most commonly the treatment is called ureteroscopy. We look into the bladder with something called a cystoscope. We'd examine the bladder and make sure there's nothing dangerous or angry in the bladder, and we see these two little slits. It's like looking at a coffee stir on an end, and that's where the ureter plugs into the bladder. Once we identify that site, usually we put a special wire that slides into the opening of the ureter and all the way up past the stone into the kidney or renal pelvis. So once we have that wire past the stone, we know that we can at least often place a stent. Once that wire's up, oftentimes we can follow it using a special scope, as mentioned, called a ureteroscope. We can get to the stone, we take that scope, guide it up to the stone, we use the laser, blast it away, the dust of the stone evacuates. Sometimes we grab the larger pieces and slide them out, and then we examine the ureter, ensure there's no injury to the walls of the ureter, and then because of the swelling that's caused by us scoping the ureter and using the laser and the swelling from the stone itself, we leave a tube called a stent. Now, that stent is a tube that goes from the kidney all the way down and sits in the bladder. So even if the stone is anywhere along the ureter, in the top, middle, or lower portion, we use this long stent. And that has been shown to be the most efficacious and the best type of drainage system for the kidney to prevent pain from recurring, allow the ureter to heal, and ideally to prevent that swelling from causing an obstruction of its own. So in an ideal situation, to summarize, we knock you out, we take a special scope, guide it up into the ureter after we place a wire, get to the level of the stone, break the stone using a laser, and then the dust flies out. Leave a temporary stent for a few days, and then that stent typically will come out in the office. What are reasons why a urologist may just place a stent? Well, there can be a number of reasons. Sometimes we can get up to that stone with our scope, and we start using that laser to blast away at that stone, and it's like a snow globe. Even though we have water that we push in there to identify and push all the sand out of the way, sometimes the visualization is just poor. You don't want to cause an injury. If we can't see the stone very well, we don't want to blast this stone and use a laser. We're worried about causing an injury to the wall of the ureter, and that can be a potential big problem down the road. A significant injury to the ureter can cause scarring, more stones, pain, and potentially kidney damage. So one of the things we can do is just place a stent, and what that stent does is it opens that ureter tube. But it takes about 2 weeks for that stent to do its thing. So that stent will bypass the stone. That stent has a little openings in it. It's like a little straw that allows any urine to drain out. You don't have that severe pain that's associated with the stone and obstruction. The stent alleviates that obstruction and preserves the integrity of that kidney, and it also allows the ureter to open up. That's the reaction of a ureter to a stent. It kind of dilates, and so that we would go back in 2 weeks later, take the old stent out, and then we can go up in there, and either that stone that was caused that snow globe, there's a lot more room to work. We can more effectively get rid of that stone. Another reason that we might place a stent without getting to the stone is if we do notice that that scope is very tight and there's any trauma or scratching or tearing of that ureter, we want to stop there and place a stent and let the ureter heal. A third reason could be infection. If there's any signs of a urinary tract infection, we'll always place a stent if there's an associated stone. The reason is when we go up to eradicate that stone, normally that ureter is tight and closed, and it just opens up enough to push little pulses of urine. So what we have to do is, along in our scope, not only we have a laser fiber that will fit, but we also have an area where we irrigate and push water to open up the ureter channel. And that water pressure can be pretty significant. So imagine if there was a urine in here that was infected and we're working on this stone, pushing water pressure basically the wrong way. We're going to push all that infection back into the lymphatics and bloodstream, and that can cause sepsis in and of itself. So by placing a stent when there's a stone that's causing obstruction and infection, all we have to do is we can look in the bladder, we can slide that wire up using x-rays, and then again, using x-rays, we can slide that stent up. There's no significant pressure that we have to use because we're not using a scope to look into the ureter. We're just using x-rays to guide that stent place. So that's a key reason why we place a stent instead of getting the stone in the same fell swoop. Another reason could be once we look up there and we see that stone may be what we call impacted. The tissue may grow over the stone, and we can only see the tip of the stone. Sometimes there's just not enough room to safely work. And if that stone's impacted, oftentimes we'll place a stent and again, come back in 2 weeks because there's a lot more room to work. Oftentimes that inflammation from the obstruction in the stone will go away, and then we can see the stone much better. When taking care of these stones, it looks like a snow globe. There could be some trauma. There could be infection. The stone could be impacted. Those are all reasons where we might place a stent and again, get out of Dodge because that's the safest thing for you, for the patient. Although it's annoying that you have to have a secondary procedure, it's a lot safer than potential harm or long-term injury to that ureter and kidney. Not uncommon that depending on the position of the stone, depending on the size of the stone, we may have to place a stent and come back another day. So as you could imagine, if a stone is stuck up at the very top of the ureter, it had just fallen and it's stuck up here like this, as opposed to down low towards the bladder, we have to take our scope and guide it all the way up to that stone. That ureter can be quite narrow at different levels. So guiding our tiny scope up to that level is more difficult when the stone is up high. You don't have to traverse as much distance if the stone is quite low. So the odds of getting to the stone when it's down near the bladder is much higher than when it's up high. So I tell folks who have a stone that's up high and they want to try and pass it, I tell them, don't feel bad if that stone doesn't pass. Even if it moves down in the ureter but still gets stuck, that ends up being an easier procedure for both you and for me, and oftentimes a more successful procedure. In that case, what happens is, again, we get the scope up, it goes into the ureter, but at some point that scope cannot safely advance. And the worry is if we push too hard, then you're going to cause an injury to the ureter, potential kidney damage and problems. We don't want to do that. So again, the safest thing would be place that stent and get out of Dodge. Last thing, I'll tell you how I do it. If there's no infection and the stone is in the ureter and is less than a centimeter or so, 10 millimeters, we'll plan for what's called ureteroscopy and laser lithotripsy. That's where we knock you out, take a scope, place a wire, place the scope into the ureter, and then guide it up to the stone, use a laser to blast it out, and then leave a stent for a few days, and that comes out in the office. That's the best ideal situation. If there's any signs of infection, if the ureter's too tight, if there's a snow globe effect and you just can't see the stone effectively, all those go into our decision-making to whether we just place the stent and, again, finish the procedure and come back another day. To summarize, your urologist just wasn't lazy. He was being safe and trying to do the right thing and ensure that your kidney remains healthy and that there was no injury. So I hope this provided some guidance and insight as to why we as urologists use stents in the treatment of stones and why we may separate these procedures into two separate steps or stages. Thanks for watching. Make sure you subscribe and have a good night.